Will pelvic floor exercises reverse prolapse is the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. While in my practice, I don't necessarily deal with patients with prolapse, I do see patients with pelvic floor dysfunction who happen to also have prolapse. So from my perspective, when it comes to exercises, which has to do with your posture, your breathing, your inner abdominal pressure, and the way your stabilizers are stabilizing you, I can comfortably tell you that there are certain pelvic floor exercises that certainly contribute positively to the improvement of your prolapse. So let's talk about it. I've done a video on what prolapse actually is and what we need to understand about it. We're going to make sure we put it at the end of this video. But when it comes to prolapse, either parts of your internal organs are coming out or partially coming out, or they're kind of almost coming out. And bottom line is your inner abdominal pressure, the distance or the pressure, I should say, between your abdominal diaphragm and your pelvic diaphragm, that pressure is off. So either it's geared more towards the front or back, or it's collapsed in the middle, whatever the situation is. So if your pelvic floor exercise has to do with the improvement of the barrel, which I have a whole video explaining on what biological breathing is from a different channel I have. We're going to make sure we put it at the end of this one so you can understand what I'm referring to. But when you improve on that, you're improving on this barrel that you're creating. So the sides, front and back, they're all musculatures that play a role in that inner abdominal pressure, the integrity of your core stabilizers, therefore impact your prolapse. So if you're talking about a specific or series of exercises that directly impact your prolapse, once again, it depends on the degree of prolapse. Kegel exercises may come in handy. However, there's so many ways to do them incorrectly. So it all depends on what kind of instructions you're getting with your Kegel exercise. There's a machine called emsella that does 400 Kegels a minute. I'm a big fan of it for cases where it's indicated. There's a value in that whole exercise where you're familiar with Kegel, where you're pretending that you're pulling into your body and through a penis or vagina, you're pulling in the pressure, or you're compressing. That's valuable to some degree. It doesn't do the magic, but it certainly plays a role. So does it harm you if you have prolapse, whatever degree that is, and you do pelvic floor exercise? The answer is absolutely not. But if you're thinking the magic that will replace the surgery for internal organs that are coming out because this is a full-on prolapse, I say that's not going to help you after surgery. Then you definitely should do the right exercises. And the key word is the right exercises. I feel that a lot of times the exercises that are being prescribed to patients are quite generic, and it's a handful, and we need to go beyond the generic ones to really make a difference. If you have any questions, make sure you use one of the methods of contact in the description box to contact me or make an appointment, whatever the case may be. And if you have not subscribed to the channel, this is your opportunity to do so as well. Thanks for watching. Take care.